Good afternoon, Sir Lee. My name is Justin C. Custodio alongside with my co-student nurse, si Windy Butong and Ivan Bahala with help from John Edma. We will be now performing the return demonstration for the assisting the client from bed to a stretcher. The definition is assisting from bed to a stretcher means safely moving an immobile or weak patient laterally from a hospital bed to a stretcher, usually requiring 3 to 4 staff members and assistive devices like transfer board or draw sheet. The procedures involve aligning surfaces, locking brakes, and using coordinated ergonomic movements to minimize friction, protect the patient, and prevent staff injuries.
So for the objective, first ensure safety for both patient and the caregiver, then minimize injury risk while transferring, and lastly promote patient mobility.
And for the safety and security measures, first is to lower the head of the bed, second is to place the stretcher parallel to the bed, and lastly is to ensure wheels are locked.
For the pre-procedural preparation, first is perform a medical hand wash and introduce yourself to a client and identify the client's identity, explain what you are going to do, why is it necessary, and how the client can cooperate. Then gather the necessary equipment, provide privacy, and make sure obtain a proper body mechanics. Then let us now proceed for the procedure proper. So, may buntag ma'am, ako din si Justin C. Custodio, your student nurse from Bukidnon State University, and alongside with my student nurse, kuan mi perform mi sa imuha ito, change na mo ka dito sa bali na mo ka sa stretcher, ma'am. Necessary ni siya, ma'am, kay kanang if kanang na ibalin ka na mo, ma'am, kay naay mga procedures, ma'am, na need mo buhaton dito, ma'am, kay since immobile ka and weak imuhang extremities, ma'am. Okay na ba, ma'am? Okay, so pwede na umaas imong name, ma'am. Okay, so ma'am, Bolotaulo, kanang during this procedure, ma'am, pwede ka mag-verbalize if maka-feel ka og any pain, and if kanang baka mga questions or clarifications, pwede ka mag-asa, ma'am. Pwede ba tayo ka na question and clarification? Okay.
So for the procedure, first check the patient's chart if there is a physician's order to transfer client from bed to a stretcher, and check for the restrictions that may influence the client's ability to move or to be positioned. So assuming that we have already checked the physician's order and there are no restrictions for the patient, let us now proceed to the next step. First is always predetermine the number of staff required to safely transfer a patient horizontally.
So for the next step is to place the head of the bed to a flat position or as low as the patients can tolerate. And next is to raise the bed to the same height as the transfer stretchers and lower the side rails. And keep the patient comfortable by putting a bath blanket over the patient and remove top covers underneath.
Next is place a draw sheet under the patient and have him or her fold arms across the chest and touch its chin to the chest. Use this to position the patient closest to the side of the bed where the stretcher will be placed. Position sa ako, ma'am, ha? Then position the stretcher beside the bed on the side closest to the patient with the stretcher slightly lower. Apply brakes. Place a rolled towel between the bed and the stretcher.
Next is remove the pillow from the bed and place it on the stretcher. Then 2 nurses should stand beside the stretcher. The 3rd nurse should stand on the side of the bed. Ma'am, kuha ko nga ako anong online mo, ha? Ano ang isa?
Move back to the side.
Then next, the nurse beside the stretcher must reach across the stretcher and grasp the draw sheet at the head and chest area of the patient.
And next step is the second nurse beside the stretcher must reach across the stretcher and grab the draw sheet of the patient's waist and thigh area. And after that is at the count of 3 by the head nurse, pull the draw sheet along with the patient towards the stretcher.
count of 3.
So, ma'am, kung sa ka na mo pakilid, ma'am, ha?
The count of 3. 1, 2, 3. Transfer na siya sa stretcher. Ito, isa pa.
And after that is, once the patient is transferred to the stretcher, raise the side rails on the both sides of the stretcher. So now we will be doing the transferring of the patient to the stretcher.
So, ma'am, may transfer na ka na sa stretcher, ma'am, ha?
1, 2, 3, go.
One, two, three. Ma'am, magbutang ka naman sa ulo, ma'am.
Raise the side rails.
Then make the patient comfortable and cover the patient with a blanket and leave the draw sheet in place for the return transfer. Then lastly is to perform the hand hygiene and document the activity.